Hi, my name is Meredith Caldwell, and today we will be demonstrating the proper technique in obtaining high-quality diagnostic OFA radiographs in our canine patient. First, OFA radiographs are very high contrast and very high quality radiographs that are used to evaluate hip dysplasia, any other pelvis or joint irregularities that may be seen in some different breeds. Our patient does need to be at least 2 years of age for these radiographs to be taken. Chemical restraint is definitely necessary, and then we will show the correct positioning and technique for obtaining these high quality x-rays later in the video. The chemical restraint that we do use in our practice is dexdomitor, given at a rate of 375 micrograms per meter squared. This does provide adequate muscle relaxation and the ability to manipulate the rear limbs to get them into proper position in taking these OFA radiographs. In our clinic, we do have a dosing chart that gives both IV and IM dosings for the dexdomitor based on weight. This is a very handy chart that makes the dosing process much easier. All right, now we're going to talk about measuring our patient. We always measure our patient at the thickest part of the pelvis. The patient does need to be in position for the x-ray when we do measure them. Tucker, our patient today's measurements at his widest part were 13.5 centimeters. So based on our equation, we would do 67 kVp and 7.5 MAS. And there he is in position being measured with the caliper. Just a brief overview, the preparations for these radiographs are to sedate, measure properly in position, set the machine, get on all personal protective equipment and your dosimeter, and have all restraining equipment ready at hand when you're taking these radiographs. Did want to show this chart that is provided with our machine. It gives the area of interest with your settings based on weight. And for the pelvis and Tucker's weight, they actually do recommend 70 kVp and 8 MAS, which is very close to the equation and the settings we got earlier. So we will see which one provides a better image. Now we will talk about collimating the machine, the primary beam. We want it to be as tight as possible. This decreases the scatter radiation and also improves the contrast of the image that we take. We want the thickest part of our pelvis towards the cathode. And our borders, the cranial border is caudal to the wing of the ilium up to the second lumbar vertebrae and distal to the patella, and our lateral borders are lateral to the ischium. When we position our patients for these radiographs, we do want them in dorsal recumbency. Their head needs to be straight between their forelimbs to ensure a straight spine. Hind limbs are extended and then the femurs are rotated in so the patellas lie in the trochlear groove. We do want parallel femurs with the tail aligned with the spine, and we need to pull the hind limbs down so that they're level with the table to ensure that we have a good quality diagnostic image for our veterinarian. The next part of the video, it's kind of sped up just a little bit, but it does show us with our sedated patient, getting him up on the table, getting him in position. Once he's in position, we go ahead and measure him with the caliper. We can measure them, make sure they're at the widest point of the hip. We can do it on this side or on the other view that I used earlier. And we want to make sure that we get a good, accurate measurement so that we can have good technical factors for a machine. We are using a plastic V trough to keep him in position. Go ahead and get him in position, get our light set, get the machine in position, make sure that our machine has proper settings done. So my assistant today is going to make sure that he is straight, forelimbs back, and I'm going to take his hind limbs, rotate the patellas and the femurs in as far as I can to get the patellas in that trochlear groove, and then pull down the limbs as much as I can to get them parallel to the table and also ensuring that I get that tail in alignment with the spine. We did leave him in position until we saw the first view, just to make sure that we didn't need to take a second one, which we actually did need to take a second one, because as you will see coming up here, this is our second view, but our first view, it does have straight femurs, but they weren't 100%. Our patellas were not rotated internally enough. We did have a nice symmetric pelvis, and then our tail was not 100% aligned with the spine. The last and most important thing with these x-rays is the proper labeling. The labeling on these radiographs does have to be permanent. It has to have the patient name or ID, the date the radiograph was taken, and the hospital and doctor's name. Here you're seeing our second image that we took, which has much straighter femurs, more parallel femurs, symmetrical pelvis, and then our patellas are rotated nicely into the trochlear groove, which shows for a much better diagnostic image.